Hello everyone, today I'm going to show you how to identify Syritta also known as the thick-legged hoverfly from photos. We'll be using the diagnosis from the Southwestern Melarodontini and Millicini guide, but this works throughout the United States and Canada. To distinguish the genus Syritta from other syrphids, you should check that the individual in question has these pale spots behind the head, and its femur is swollen, convex ventrally, and has these small spines. There are a few ways to identify Syritta. Because there is only one other species of Syritta in the Nearctic region, this diagnosis is rather simple. First, I would recommend looking at the scutum. Right here is a transverse suture. In Syritta flaviventris, at the apex of the transverse suture, up here, there's a small white spot, as we can see on the next slide. You can see an example of this here. Sometimes the spot can be smaller and less distinct, so the scutum feature should only be used if you can clearly see that the spot is present, or you have a very nice photo that you can see that the spot is not present. The next thing to look at, which is usually consistent, is the legs. In Syritta, the fore and mid legs have darker brown or black spots in the middle of the femora. However, Syritta flaviventris can rarely also have that, but not to the extent that Syritta does. I'd also like to mention this feature, the wing with spurious vein versus without spurious vein. This feature is very difficult to see in photos, so I would only try to judge it if you have a very nice photo where you can see a spurious vein, like here, or a specimen. The easiest way I found to distinguish these species is using the markings on the abdomen. Males of Syritta have thick medial stripes on tergite 2 and 3. Contrasting that, males of Syritta flaviventris either have almost absent or completely absent bands. It should be noted that these can sometimes be slightly thicker, but they'll never be as thick to the extent in Syritta. Female Syritta can be recognized by the subrectangular white markings on the fourth segment. As you can see here, the markings are somewhat horizontal in the posterior view and do not extend far down the side of the tergite. However, in some cases where they do extend down the side of the tergite, the posterior border of the macula will not be as concave. Let's look at some examples. Here's our first one. First, let's look at the thorax. We're trying to determine if there are white spots between the transverse sutures. Right here, I believe I can see those, right here and here. Therefore, we know this is not Syritta and can only be Syritta flaviventris. Next example. This looks to be a female. The abdomen is relatively wide, and the last segment is present but very small. I'm going to look at the abdomen first. We can see that the macula does appear to extend along the side of the abdomen, but the posterior margin is very concave. So this is Syritta. Next example. From this image, it's not easy to determine the sex of the individual, but looking at the abdomen, we can somewhat see that the tergites are pretty narrow. From our knowledge, we know that male and female Syritta both have thick medial stripes on the abdomen, whereas we know that in male Syritta flaviventris, tergite 2 and 3 can sometimes have vestigial to absent medial stripes. So we know that this is a male Syritta flaviventris. Last example. This looks to be a male by the constriction of the abdomen. Male Syritta, unlike flaviventris, have this thick black band in the center of the tergites, as we can see here. So this is Syritta. Thank you so much for watching. I hope this is helpful. Please leave any questions you have in the comments.